Hello everyone, you're watching sqadia.com and I am Ahmad Haider. Today our topic is peripheral nerve disorders. In this we have 5 sections and we'll be going through initially through the nerve damage and its classifications. What are the different type of classification, that is we'll be briefly going through the Sunderland and Seddon's classification. Then how the nerve recovery actually takes place and how we can access the functional impairment of the nerve in upper and as well as the lower limbs. Then in the next section we'll be discussing briefly the principles of the treatment. When we have to wait, when we have to go for electromyographic studies, when we have to do NCS, and when we have to operate, whether we have to put a graft in or when after what time we have to go for standard muscle transfers. In the fourth and fifth section, we'll be briefly going through the lower nerve limb injuries, especially the peripheral nerve injuries of the lower limb. We'll be briefly discussing anatomy of lumbosacral plexus, femoral and peroneal nerve injury, tibial nerve injury, and lastly, the most importantly, the sciatic nerve injury, which is now actually one of the very common injuries, especially associated with total hip arthroplasty. Thank you very much. Keep watching sqadia.com.